My name is Dr. Ahmed Arslan, and today the topic of my presentation is thermal burns. So, thermal burns are defined as tissue damage caused by transfer of heat energy to a tissue. And in an eye, the damage is primarily caused by denaturing and coagulating cellular proteins, and secondarily by causing vascular ischemia. So main sources of these thermal burns are flame burns, like an eye being exposed directly to a flame, explosions like blasts or firecracker injuries, electrocution, and these injuries can also occur due to warm liquids being poured into the eye. So, as eyelids are the first structure to protect the eye, so they bear most brunt of any thermal burn to the eye, and they are mostly involved in these thermal burns. So, they can range, they are classified according to the classification through which skin burns are classified. So, first degree burns, these are superficial burns commonly caused by short duration flash burns. Most common features are edema and erythema with pain and loss of eyelashes can occur. This type of burn can heal in less than 1 week by superficial peeling off of the burnt skin and no scar formation. This is an example of a mild or first degree burn to an eye. A little more severe than that are second degree burns. These are partial thickness burns. These can also be called by scalds or longer duration exposure to flames. And features include blisters, weeping of skin, erythema, and severe pain. The second degree burns are most painful of the three, as in these burns the nerve endings are most exposed of the three. And there is also temperature sensitivity. This type of burn usually heals in 1 to 4 weeks, and there is some associated scarring and pigmentary changes of the skin. And the most severe of these are third degree burns. These are full thickness burns. They can be caused by chemicals, electrical, and flame injury. And the features include a dry, charred skin, and these are not painful because nerve endings are destroyed because of heat. And healing involves scar formation and varying degrees of loss of function of eyelids. Conjunctival burns. Burns to conjunctiva can cause erythema of conjunctiva, conjunctival injection, and conjunctival chemosis. Conjunctival burns can cause severe dry eye as a later complication due to damage to goblet cells and accessory lacrimal glands present in conjunctiva. And conjunctival burns are usually associated with corneal burns, which are more severe. These are example of damage to conjunctiva. Here we can see the erythema and conjunctival injection with associated corneal burn. Corneal burns. These corneal burns are very dangerous as they can cause permanent vision loss in a person. In low severity burns, there are superficial corneal epithelial defects. More severe burn can cause severe limbitis, permanent opacification, stromal melting, or even perforation of cornea. In case of significant limbal ischemia, conjunctivalization of cornea can occur with opacification of cornea as a later complication. In conjunctivalization, because of ischemia and other damage to cornea, the conjunctival vessels and conjunctival tissue can grow over the cornea and inhibiting the entry of light into the eye. This is an example of burn to conjunctiva. There is conjunctival opacification. Here some of the vessels are encroaching onto the cornea, and there is associated conjunctival damage as well. Then we can talk a little about the complications. After a burn, there can be loss of lid tissue that can lead to exposure keratopathy, lid cicatrization, that is scarring or charring of the eyelids can lead to ectropion, trichiasis, and corneal exposure. Epiphora can occur due to damage to lacrimal system, and as a later complication, traumatic cataract can develop after a burn trauma to the eye. This is an example of a severe burn to the eye. We can see that lid tissue is damaged or lost because of burn. The conjunctiva is also burned, and the cornea is completely opaque because of a burn. Management. First of all, the management should begin with assessment of airway, breathing, and circulation. If there is any issue with any of these, then first they are to be addressed, as they can be life-threatening. After that, we can proceed to assessing the damage to eye. A thorough history and examination is useful in determining the severity and extent of the burn. If there are any foreign objects present in the eye that can further the effect of heat damage, it should also be removed. In superficial burn, cold compressions, lubrication, and pain control are the mainstay. In partial thickness burns, topical antibiotics are very important to prevent infections. Copious amount of lubrication that can be achieved using occlusion dressing or moisture, or maintaining a moisture chamber. Uh, Eyelashes are to be trimmed if they are burnt, because they can cause a lot of irritation. Lid closure or temporary tarsorrhaphy can also be considered if there is risk of corneal exposure. In full thickness burn, and the initial management is same as that for partial thickness burns, but along with that we have to debride dead tissues and scar if they are formed. Protection of eye is achieved using a special type of dressings like Gelonet and Gallipram dressings. Tarsorrhaphy in case of exposure keratopathy, and further management is usually done by oculoplasty team if there is any graft are required or further debridement is to be done. Thank you very much.